What's up everyone? Today I'm going to discuss how to start an IV. I'm going to include all the steps on how to prime it and get it ready. And I'm also going to show you a live demo. So if you are squeamish to blood, I suggest you kindly watch another one of my videos. In addition to that, I'm also going to show you how I remove the IV. My name is Christina, nurse practitioner. Let's get started. Okay, so here is your basic IV start setup. So before you start, you want to make sure that you, 1, have a doctor's order, 2, you have the patient's verbal consent. You want to gather your supplies. If I have to start an IV and I also have to do a blood draw, I will also, in addition to the IV setup, I will include a vacutainer and the tube specimens that need to be collected, so that way I don't have to puncture the patient twice, and the patients really appreciate it. So before you start, you definitely want to gather all your supplies and wash your hands and have your gloves on. So here is your 20 gauge angiocath IV. With this, I wanted to do a close-up to show you exactly what we're working with. Some other gauge IVs that we use can be a 22 gauge or an 18 gauge. However, ideally, when you start an IV, you would like to have a 20 gauge. So if I take off the plastic cover so I can show you visually what we're working with, anytime you're going to puncture the patient to start an IV, you always want to make sure that the bevel is pointed up. You never want to point it down, you always point it upwards. When you puncture the patient and you see a flash of blood, that's when you know you're in the vein. You'll see a flash of blood within this chamber here. So then that tells you you're in. So if you look closely at this point here, there's a little ridge, and that's what you're going to use to advance the catheter in. As you advance it in and you feel like you're in a good spot, then if you're not going to draw blood, if you don't need blood, but you see the flash of blood, then you're going to release the tourniquet, you're going to apply pressure at the top, and then to release the needle, to retract back, you push that white button and it retracts back and it leaves the plastic catheter in. Inside your IV start kit, you're going to have your plastic tape. Make sure that the patient doesn't have any allergy. You're also going to have a ChloraPrep. In addition, you want to make sure that the patient doesn't have any allergies to ChloraPrep. You're going to have your 2x2 gauze, your tourniquet, and then below that is your Tegaderm patch, and then there's going to be a label that you apply on at the end. Always make sure you check the expiration dates and make sure nothing is expired. Then you have your saline flush, which you're going to use to flush your IV extension, which is here. So your flush, what I like to do is I will open it. And I don't like when there's bubbles in it. So what I do is with my thumb, I push back a little bit and then I push up because I don't want any bubbles. I'm going to do that again because I see bubbles. One of my little pet peeves. So you see that? So that's good. So there's no bubbles, and I don't want it inside the chamber here. So then I'm going to attach it to my port. So I attached it. Okay. And then this is where I'm going to flush. And you'll start, so I'm going to push it through. It just needs a little bit, maybe about half a cc. That's it. And then this here, this is if you need to clamp it. It's like a little clamp. So when you have like a really, really good IV and there's good blood return, sometimes if it's not being used, you can clamp it so that you don't have that return. And then you flush it. And what I also like to do to save me a little step, I'll open this just a little bit because you're the only person in the room and when your IV is attached, that's the last thing you want to do is try and open this while the IV is not secured in place with the extension, and you could potentially lose it. So I don't take it completely off because you have to keep it clean, but I move it to where it's easy for me to remove off with one hand. So that way I can keep my other hand on the patient's IV that I'm trying to secure. So before you start, you definitely want to make sure you do your hand hygiene, you have your gloves on, you have your IV set up. So you position the patient in a very comfortable spot to where the patient is comfortable and you are comfortable. So you're going to, I always have the patient extend his arm. I want to make sure it's a safe spot too. I want to make sure there's no clots like DVTs. I also want to make sure they're getting dialysis. They don't have any fistulas on this arm, or if it's a patient that may have had a mastectomy, I want to make sure I avoid the whole limb of this arm. And I just had a recent video that I did how to find a vein, and so that will be very resourceful. So let's start with putting on the tourniquet. So I'm going to put on the tourniquet. I'm going to make it a little tight. I tell them this, and I'm going to have you make a fist. Okay. So now I'm going to look for the vein, and it's not what you see, it's what you feel. So you want to feel that bounce back, and definitely I have it there. Okay. And you want to make sure you kind of get a vibe with the patient because they can be a little squeamish with IVs. With your ChloraPrep, you want to activate it, turn it on, squeeze it, and clean the area. So I feel a really good bounce back here, so I'm going to go there. Okay. So you clean the area. I also like to use alcohol preps because it just gives you that extra layer of cleanliness. Okay, so I know I'm going to go there. Now I have the IV and I have all my supplies ready. What I also like to do is get my tape, and I'll take a little piece of tape out and I'll kind of open it this way, and that's what I'm going to put on the patient. And I'll show you as I get it. Okay. So I have all of my stuff ready. So what I'm going to do, I'm going to pull back the vein. I'm going to tell the patient I'm going to puncture them, and then the bevel is always up. I'm going to have them relax because when they tense up, their veins will clamp on you. So I'm going to have them tense up. I see the blood. You see that flash of blood in the chamber? I'm going to use my thumb and advance it forward, and then I'm going to let go of the tourniquet. I'm going to hold down and I'm going to retract back. Sometimes it can get a little bloody, and that's okay. I'm going to clean the site. So we attach the extension cord. Everything is nice and clean. This is a really, 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 really good IV. Okay, so you just have to make sure that the patient keeps still, doesn't move his arm. So we're going to draw back, and obviously there's good blood return, so I'm going to flush the IV. Okay, I'm going to ask the patient, how are you doing?
Good.
Awesome. I'm going to put that to the side. And then so just like I had said earlier, I'm going to tape it to secure it because sometimes this can get dislodged, and that's the last thing you want to do for the patient. Okay, so I'm going to get the tape. I like to put it on the bottom. And I like to wing it around. So I'll wing it around. And wing it around on this side, wing it around on that side. And then I'm going to get the Tegaderm, make sure they're keeping still. I'm going to apply the Tegaderm. I'm going to take out the outer perimeter of the tape. And then I'm going to apply the label, and I'm going to put my initials on it, and I'm also going to put the date. Okay? And then what I also like to do is just make sure it's nice and clean and pretty for them. Just clean around the site. And then I'll tape it here. So I'll detach this since we're done. And then I could also clamp it because it's not being used right now. And then I'm going to apply some tape to here on the side. And then it's ready to go. And we're all done. So here I'm going to show you how to remove an IV. The IV will be removed under the circumstances that the patient will be discharged home from a hospital, or if it was an outpatient surgery center, or if the IV went bad, you would definitely remove it. If there was signs or symptoms of phlebitis, redness, irritation, or pain, you would definitely remove it. Or if it wasn't needed, you would remove it as well. Or sometimes it gets dislodged on its own. So this is how I would remove it. Okay, so I'm going to use alcohol preps. I like to use the alcohol preps to moisten the skin area to remove it, especially if the patient has hair like around this area. I don't want them to be hurt. I try not to do that. That's the last impression that I want to leave on them, especially if they're going to be leaving. So I'll use this alcohol prep to kind of loosen it up, so it doesn't hurt. Are you doing okay?
Uh-huh.
All right. So I go along the perimeter of it, and sometimes these tegaderms, they could be so intrusive and just the stickiest things ever, which is a good thing because you don't want it off. So we got that. So now all the tape is off, all that good stuff. I'm gonna grab my gauze. I'm gonna apply it to the skin, and I'm just gonna remove it out. I'm gonna apply pressure. And if the patient gets kind of oozy, I make sure that they look away and they don't look at the area. In addition to that, I want to make sure when I'm looking at the catheter site that it's intact and that it's not kinked. And that is what I'm going to chart on my flow sheet, that the IV catheter was removed, catheter was intact, and pressure was applied. And then I'm going to, once I am done applying the pressure, I'm going to apply a little piece of tape. And the patient is good to go. So we'll just do the tape. I also want to make sure they're okay with plastic tape. And then I'll kind of apply pressure and have them bend their arm. And then that's it. That wraps it up. Thank you so much for watching. Make sure to subscribe for upcoming notifications. Take care.